My name is Dr. Varinder Mahi. I'm MD Medicine. I'm practicing as a general physician at Guru Nanak Mission Hospital, Jalandhar. I have an experience of more than 20 years. So today we are going to understand about the hypertension. So the first of all, generally everyone would like to have healthy and normal blood pressure. What exactly does it mean? Basically, each time when the heart beats, it pumps blood into the vessels. This creates pressure against the wall of blood vessel. This is called blood pressure. Normally, in healthy person, it rises and falls throughout the day. This is called circadian rhythm. But when the blood pressure remains high for a longer time and left untreated, it can lead to serious health problems. In general, the persistent increase in blood pressure higher than normal pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, sedentary lifestyle, obesity, smoking, excessive alcohol consumption, stress, and etc. There are other risk factors that can also increase the risk of developing hypertension, such as age, family history of high blood pressure, excessive salt intake, not eating enough food like with potassium can increase blood pressure risk and risk of stroke and chronic kidney disease. Eating processed food and fatty food increases fat throughout the body and make the heart work harder to push through body. So it can also lead to hypertension. Uh, Another one is stress. Reacting to stress in unhealthy way and not managing stress can also increase blood pressure. Moving on, hypertension does not have any obvious sign and symptom. That is why it is often called as a silent killer. It puts patient people at risk for several diseases like kidney disease, heart disease, stroke, even eye damage, and it can even lead to blindness. Hence, early and accurate diagnosis is very important in the management of hypertension. Measurement of blood pressure is the only way to know whether the person is having high blood pressure or not. Generally, when the symptoms occur, they include morning headaches or tiredness, vision changes, buzzing in the air, fatigue, nausea, or vomiting. But most of the people do not perceive these symptoms. Is usually silent. If the person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called a sphygmomanometer. Blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 over 80. It can also read as 120 is the upper one, and the 80 is the lower one. And the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, where the lower number indicates diastolic blood pressure, which means pressure in the blood vessel when the heart rests between the beats. If the blood pressure level is equal to or more than 140 over 90 in people less than 60 years of age, and more than 150 over 90 in people more than 60 years of age, the person have hypertension. If person have BP level higher than this, then he or she might be at risk of developing serious heart diseases. So these risks can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, quit smoking if you are a smoker, or regular blood pressure monitoring, stress management, and adherence to prescribed medicines. So if the blood pressure is successfully controlled with such lifestyle modification, then it might avoid delay or reduce the need for medication. So let's take a look at these strategies one by one. So first of all is a regular exercise or physical activity. It is usually recommended to walk for at least 30 minutes daily for minimum of five days in a week. So healthy diet, we should follow the healthy diet. So there are different diet recommendation like DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, and limiting the amount of sodium in diet, and avoiding alcohol consumption. Always read food labels. If possible, if you are eating a packed food, eat pure processed foods. Do not add salt, just 1 level teaspoon of salt has 2300 milligram of sodium. Avoid adding salt to food. Use herbs or spices to add flavor to your food. Quit smoking. Regular blood pressure monitoring. Stress management. Adherence to medication, and medicine is to low blood pressure may be recommended by a doctor if your blood pressure is consistently high, usually at or above 140 by 90 millimeter of mercury. Adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy lifestyle. Adapting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in normal range is very important in preventing cardiovascular complication. It is very much possible to maintain normal blood pressure level with the regular monitoring and preventive cares. Thank you.